Welcome back to Patient Win Insider. I'm Nick Moen, and today I'm joined by Dr. Juliana Correal. After 14 years inside a high volume practice, Dr. Correal walked away from the DSO hamster wheel and opened Viva Dental Studio in Davenport, Florida. She built a spa like family first practice from scratch, broke even really quickly, and now she's focusing on whole body minded dentistry and patient education that she coins smile coaching. So today we'll dig into kind of DSO burnout, systems and teams that she built, and what's next for her practice. So let's get into it. Thanks for coming on, Dr. Corio.
Yeah, thanks for having me.
So tell us about, let's go all the way back. Tell us about your early career. 14 years at the previous practice group. What, how did you start? And then what did you learn? What really stayed with you from that experience?
So I graduated dental school. I went down to Lakeland and I worked in private practice for 6 months. And I was opening up two offices for dentists down there. And as a new grad, the only thing I wanted was to number one, get out of debt. And number two was get crazy amounts of experience so that I can get good at this, right? But opening up a dental office in Lakeland and as a brand new dentist, it was like no man's land, right? When you're opening up a dental office, you don't see a lot of patients. And I wasn't getting paid very well. And I was out in the middle of nowhere. My family's from Sarasota. So I was just miserable. So after 6 months, I was like, I can't do this. I'm not happy here. Like, this isn't going to be good. I can't just continue to like stay here. So my friend was actually working for a DSO out in Orlando. And she's like, you need to come over here. We see crazy amounts of patients, and you'll like it here. So I moved to Orlando, and I started working there. I opened up close to two offices for that DSO, and I trained tons of doctors for that group. And it's not your traditional DSO, it's a privately owned group practice, but they have like 60 plus locations. So it all works into like a DSO type of thing. But I loved it there. I loved working there and I got crazy good experience to the point where I wasn't even worried about the dentistry. I wouldn't look at my schedule the next day and be worried about like who's on my schedule, what am I going to do? No, I wasn't worried. There was nothing in dentistry that made me worried anymore. Everything crazy that could have happened had already happened, or I felt confident enough in my skill that if something did come up, I had enough stuff in my tool bag that I can, create a solution for it. So I wasn't worried about the dentistry. Then I started, growing personally. Like I got married, I started having kids. And, during all this time, you like keep your head down and you're working and you're just worried about picking up the kids and like doing that other side of your life. And before you knew it, or before I knew it, it was a lot of patients. We were seeing a lot of insurances. So it's an insurance driven group practice. You're having to see a lot of patients, over 40 patients a day, and you don't get to have that one-on-one connection with patients. You go in, "Hi, how are you? What's going on?" And you better tell me within those 30 seconds because if not, I'm out of there and you're stuck with my assistant and that's it. You don't get that quality, as much as I tried to do quality of dentistry because your level of skill and the fast your how fast you become as a dentist operates up here, but that quality chairside bedside manner, you don't have a whole lot of room for it. And so it becomes really really hard to keep everybody happy. It's hard to
Right.
keep patients happy, it's hard to keep staff happy, and before you know it, no one likes coming to work.
Right.
And all you're trying to do is see your patients and leave to go pick up the girls at 4 o'clock, right? Before they start charging you for daycare. So you're rushing and you're trying to motivate staff to see the 40 patients. You're trying to just get through your appointments with patients and hopefully they're okay and they're not griping too much, but people are just miserable all around because the whole system of the hamster wheel is nobody's happy. Staff isn't happy because you're literally stretching them so thin to try to squeeze in so many patients so that you are profitable. And patients, they feel that they don't feel that they're being listened to or taken care of. You're just another number. I need to quickly get out of this room because I have four other patients waiting. And so people feel it. And at the end of the day, it just comes on you and you can't make anybody happy. And I think that's where burnout starts.
Yeah.
It starts where you're failing at work because no one's happy. There's so many complaints coming on from every angle. Staff is saying that this one is doing it wrong, but this one's doing it wrong because everyone's just working at such a high level, high, fast pace that there's so many errors coming in and no one's checking it and everyone's getting blamed for it. Staff is saying they're not getting compensated fairly because of all the work that they're doing. And then patients, they get the short end of the stick, like
Yeah.
by far. And then you're rushing home, and then you have all this stress from work, and then you're bringing it home to kids that don't deserve that. And then you feel like you're failing as a mom because you can't make
Yeah.
anybody happy. Like
Yeah.
you can't go to all of the events. Like you're seeing such a high volume that if you cancel one day because one of your kids are sick, there's so many people upset at you. So that's how burnout happens. And you're fine and you're fine and you're fine and you keep chugging along and it was just a bad day, and until you realize I can sustain this machine.
Yeah.
Yeah.
So ultimately, you took a giant leap, and entrepreneurship's no walk in the park either, but you took a giant leap and said, I want to slow down, get my work-life balance in order, and put the patients first, right? And so you decided to
Yeah.
start Viva Dental Studio, and you started from scratch. So
Yeah.
what did that look like? Like, how did you make that decision, and what did it take in order to see it through?
When I realized that I wasn't happy, and it took a really long time to realize, number one, I wasn't happy at work. And number two, what is it about the work that I'm not happy? Is it the dentistry and all? Because at the first glance, you think it's the dentistry. I just don't want to be a dentist anymore. It's that. But you realize that it's not the dentistry. I'm really good at my job. It's just the noise around the dentistry that is making it impossible to breathe. And so you feel very overwhelmed. And so, coming, first of all, identifying what the problem is and how to find a solution to that problem is what's going to make me happy within dentistry. Is it the amount of patients? Is it ownership? Well, what does ownership look like? Does the grass look greener on the other side? And I'm just looking at another problem
Yeah.
because I like clocking in and clocking out, right? I have no problem with that. But it's having to sustain everything within that model that becomes unbearable. So it took me a while to make a decision. It took me at least 3 years to say, that's it, I'm done. And I, at this point, I had talked to a lot of my friends, some who were owners, some who were associates in private practice, many other types of DSOs I looked into to see, well, is it this model that I don't like, or is it something else? You have to really decide what it is that's not flowing and what's going to be compatible to what your outlook is. And I decided, you know what? I can't conform to anybody else's stuff. I'm going to make it what I want it because it's my happiness and the way I'm going to deliver care that's going to make it the best for me, right? For me. Like, I'm not going to try to duplicate what I came from because it wasn't working for me. So I need to find a clean canvas that I can put myself in there and I can help patients. I can still meet the needs of my family and still meet the needs of my patients and do good work without having to compromise so much of myself, you know?
Yeah. And
So
so
that's why I decided.
what boundaries did you have to set, to protect your well-being, accomplish that, and how did those boundaries shape your schedule and reflect on your team?
Boundaries are rough. They're hard to set.
Yeah.
They're really hard to set because, just a little background of me, I wasn't born in the United States. I was born in Colombia. My family came here. And all I know is work. All I knew growing up was I didn't want to be poor. So, what does that mean? That means that you put your head down and you work really, really hard and you try to do the best you can. And so, that's all I knew. So, going into that DSO practice where all you're doing is working. Well, I don't feel overwhelmed with work. That's what I do really good at. The problem is I get into this mindset and before you know it, I'm burnt out.
Yeah.
So learning how to make those boundaries has been really hard and part of the growth process. It was part of the growth process of deciding how I'm going to leave and what is the solution to my burnout. So when I decided to open up Viva, I have to have a really strategic plan of what does my growth look like here at Viva and what is it that's going to make us happy. So number one is I really want to make sure that I have a team that's happy coming to work because that means they're going to be productive and that means that they're going to get satisfaction out of what their workday looks like. And that's going to make be a win for everybody. And the same thing with me. So we're constantly looking at the schedule. We're seeing, okay, we got to make sure that we figure out a good template where we are productive, but we're not sacrificing care. And so that's a balancing act. And every day it's a balancing act. It's a lot of team meetings, what worked, what didn't work, and being okay with change.
Yeah.
And I think that's what's hard about boundaries
Yeah.
is that you're scared to like make change because you don't want to disappoint anybody.
Sure.
But at this point, we have to, right? We're small enough that we can make those changes and we need to for the vitality in the long run. So how are we keeping the boundaries and how are we setting them? By having team meetings, constantly talking about what's working, what's not working, what does growth look like in 5 years? What are we trying to develop here? Is this a practice that we're only focused on productivity? Or is this a practice that's going to be serving the community? And so that's what I want to do. I want to serve the community and focus on how we can help other people with our education and our ability and let the chips fall where they may, because it does. Productivity will come in and of itself when you're not focused on so much of the numbers all the time.
Yeah. Well, let me ask you this because you started, I mean, obviously you kind of had an idea of how to build it from scratch, but why didn't you just buy another practice? Like, what was it that you said, all right, I'm going to build this from the ground up?
It's the same reason why I didn't go to another DSO, because it's not I don't want to try to fix other people's problems because if I could have, I would have fixed the problems in the DSO that I was for 14 years.
Yeah.
Because I didn't leave the DSO because they didn't treat me well. I had a great, I can't say anything bad about that practice or that group because it made me the dentist who I am today, right? They gave me so many opportunities, but it's that model. It's constantly fixing other people's problems and trying to change systems and stuff like that. No, I wanted a clean canvas. I wanted to go in, clean canvas and do this and I didn't want to have to fix a lot of work. As a dentist who has trained a lot of doctors, I know that everybody's clinical skills are not the same. And if you're buying an acquisition, you're seeing a lot of issues with other people's dentistry. And I didn't want to feel burnt out having to fix other people's problems because I already come from that. A lot of the times I was fixing other people's problems and again, burnout. It's trying to find out what is it that you're not happy with. And then knowing that you can't continue to do that because it's not going to make you happy in the long run.
Yeah. And so your vision starting from scratch, I mean, this holistic idea of patient respect and building like a spa-like experience where the patient comes first, like what does it take to do that? Like what design or processes or, correspondence with the team, like managing the team, like how do you communicate that experience so the patients feel it?
We have a lot of training within our staff to make sure that they do what's called the Viva feel, because we want to make sure that we're always bringing in that feeling into everybody's experience when they come in here. And how do we do that? I just think of what would I like as a patient? How would I like to be treated? I want an office that when I come in, people are kind. It's a calm, soothing environment. They're talking to me, they're explaining things, they're educating me. No one is rushing to get out the door. So it's not about the numbers in terms of quantity, it's about the quality of care. So we're trying to treat patients where we're trying to do as much possible within that time frame for that patient instead of breaking things out two fillings at a time, three fillings at a time. You know what I mean? You're wanting to do quadrant dentistry. You're wanting that whole experience to be more conclusive and more, yeah, just overall, you're just focused on that one patient and getting everything done within that time frame that you can so that they feel like they're actually getting a difference and you're investing their time in them.
Yeah. So you had the heart behind it, the heartbeat's going,
Yeah.
but what about the business aspect? I mean, it's
Yeah.
such a big risk to build anything from scratch, but especially a practice, take on debt. And I mean, a lot of new practices will be in debt for years, are underwater, maybe not profitable. What did it look like for you? Like how quickly did you reach profitability? And do you think this model, it was like, oh wow, this actually works?
Like what model? My model?
Yeah.
So the first month, so I started where we were only working part time. I was only working 2 to 3 days a week max so that I would keep my overhead low. And I was trying to see patients during that time. And I was just making sure that I was getting work done during that time for that patient. So a patient came in, we weren't scheduling 40 patients a day, right? So the 3, 4 patients that we saw that day, we were doing the cleanings, we were doing the fillings, we were doing all of the things so that we would stay productive, where we're not having to see 1,000 patients a day. And, that and managing what insurances you're taking, because unfortunately, as insurances is really hard to take because they really don't pay dentists well.
Yeah.
As a startup office, you need patients to come through the door, and
Right.
you need volume, but you don't need that much volume, but you need volume. So, because you just opened the door. So, you need patients who have insurance, and you're working with that and looking at your overhead, making sure that that's okay. Taking on a lot of debt is scary, but I broke even the first month and I was only working 2 to 3 days a week.
That's amazing.
And
So
then,
you're productive but not busy, right?
yeah, I mean, working 2 to 3 days a week, seeing 3 to 4 patients those days. I mean, I think you could do that. But again, my dentistry, I've already been a dentist for about 14 years. I wasn't worried about the dentistry. I feel comfortable in my treatment planning. I feel comfortable in my skills. I've invested thousands and thousands of dollars in my continuing education. I have a lot of tools in my tool belt that I can offer patients. It's hard when you're a new grad and you're opening up and you don't have the stability within your dental experience, and then you have this. So I do have to say that, as scary as it is at my age opening a brand new office, I am blessed in the fact that for me the timing was perfect because I have one less thing to worry about. I don't worry about the dentistry. I'm only focused on how can I make this experience better, how can I be a good service to my patients, and are we able to pay all of our bills so
Yeah.
that we can continue to function. So the first month I broke even. The second month I started becoming profitable. By month 6, I was paying myself. So it's okay. It's okay. I was getting paid very well at the DSO. Am I getting paid the same as what I was getting paid before? No, but it's okay. It's all right.
Yeah, the work-life
And
balance is there.
yeah, yeah, it's gonna be all right. Even if I had to take a pay cut, this is so much better. If I continued on the path that I was gonna become disabled because everything was hurting. My neck, my back, my shoulder, my hands, like everything hurts. I was gonna either become disabled or, things crumble. You come home, your marriage is hard, life is hard because you're so unhappy at work. So things have gotten so much better on every aspect. And again, it's because you had to set the boundaries.
Yeah.
But this was a lot of sacrifice. It's a huge sacrifice for my family, and without them I couldn't do it. But this is long term what's going to be best.
Yeah. So you're holistically, like, you're breathing again. You're
Yeah.
comfortable and feeling good with your decision. How does that reflect on the patients? What does a consult look like? How do you coach them through what they're doing?
So we get them in, we sit them down. We have like a comfort menu. They get to pick out of a list of items like a pillow. Do they want a beverage? Do they want coffee? Do they want soothing glasses? Do they want aromatherapy? Like all of the things that it's going to make them feel like,
Yeah.
right? So the moment they walk in, my front desk stands up. She greets them. She offers them something to drink. The environment is everything is white in my office, white and gold. So if you go to my website, you can see like what the office looks like. The noise, there's no noise. There's classical music playing, spa-like music playing. Everyone is talking at a normal level. No one's shouting, no one's screaming. They go to the back. We offer a comfort menu. We take x-rays, we take digital scans, we take intraoral because we need all of the things to do the dentistry the right way. So you can't skip out on the technology. That's so important for diagnosis and for making sure that your clinical skills are doing well. So I go over the x-rays, then I put it on a screen in front of them. They're looking at their x-rays. I'm pointing things out on their x-rays. I'm looking over their digital scans, looking at them with them. Look at your bite. Do you see how it's collapsed? Do you see the wear? You see where this fracture line is? We talk about their TMJ issues. We talk about sleep apnea issues, medical history, and then we present it all. There's some patients that have a clear example of what they're wanting when they're coming in. We have other patients that we do things little by little, like, okay, let's focus on this, let's focus on that. You really have to get a feel for your patients on what they're wanting. I'm a big proponent of not being a pushy person because I can't be like that. I can't be like car salesman-y.
Yeah.
So I show everything to the patient. I put the ball back in their court. We are here to help you. We are here to manage your care, but you are the one who's wanting to have to create the urgency. You're the one who's going to want to. And so we present it in a way where it shows that we care about them and these are the things that you're going to need to be disease free and how we can do things better. And then we show them how to brush their teeth. We literally give them a mirror and we're like, show me how you brush your teeth, and then we'll show them the right way to brush. Show me how you're flossing. That's not the right way to floss. Let me show you how to floss. Let's go over oral hygiene. I mean, our appointments are at least 90 minutes
Wow.
because that first impression, I mean, we're treating them like their family.
Yeah.
We want them to be part of our family. It's important that we establish that first meeting of what are the things that we need you to get to be back on being healthy and how are we going to help you with that? We're not
Yeah.
going to give you a to-do list, throw it at you, go home, call me when you're ready. No, we're holding your hand, we're listening to you, and what are the things that are going to make you want to move forward and make a priority for you? So
Yeah. And
that's what we do.
how do you fold in from like a holistic perspective? How do you fold in whole body health during these sessions?
We integrate it
Yeah.
going over the medical history.
Yeah.
So we have a lot of good questions on our medical history form. We not only have medical history, but we have a dental history form. And in our dental history form, we talk about, are you grinding? Does someone else hear you grinding? Are you snoring? Has anyone recommended guards for you? Or have you noticed that you've been breaking teeth? Even when we start, like for example, a person who grinds their teeth, or they come in when they have a broken tooth, and we put that x ray up and we put the intraoral scan up, and we're like, have you noticed that all of your first molars have root canals and crowns? Why is that? I mean, it's not normal for you to just break teeth. People don't just break teeth. So,
Right.
again, it's reinforcing that education on let's look at this besides a reactive experience. Like, I can fix teeth all day long, but I don't want to have to fix your teeth. I want to give you the education on why this is happening and how we can be preventative.
Yeah.
So within all of that, that's how we tie everything in. What's going on? Are you stressed? Well, what are we doing for your stress? Make sure that you're exercising. Do you need to go to physical therapy? Like, what's going on? So we dive into all of that stuff to really get a feel of why are things happening? Why are things breaking down? Why is your oral hygiene this bad? Do we have depression components in here? Are we having manual dexterity issues? Is there rheumatoid arthritis involved? Like, what's going on? So, is there acid reflux? Have you gotten that checked out? So, you really have to look at all of this because you could fix teeth all day.
Yeah.
But I don't want to put things in people's mouth that they're just going to continue to fall apart. So that's where the education really comes in.
Yeah. So it seems like you're really excited about what you're doing, showing up to work and supporting your team and helping the patients. And that feels like success. Where are you headed? Like what are the next what does growth look like? What are the next steps and where do you see yourself in like 5 years?
In 5 years? Oh my gosh, I'm just trying to get through today. No, I'm kidding. So for this year, our main goal is we want to start introducing sleep apnea into our office. I'm going to go get trained. I want to become a diplomat. So that's like my goal. So that's on visionary board that I did. So that's what I'm really focused on. 5 years for the practice, I'm hoping that we have a full-time hygienist obviously by then, and we build out more rooms. Right now, I'm working out of 3 rooms, and I used to work out of 7. So 3, but it's okay. And I want to build out more rooms. And yeah, just continue to grow and get an associate and be able to continue with my work-life balance. I think that's what is important.
Yeah. Well, I'd love a little tidbit here. I'm curious, because you've come a long way. And what would you say to a dentist or doctor that's stuck in like a high volume, more impersonal system that wants to get out? Like, what would you say? What's the first step you'd say that they could start doing tomorrow to make a change?
I think they really have to self-reflect. I think you have to realize, well, why is it that you're wanting to leave? Is it the high volume that's killing you? Is it your dentistry that is failing and that's why you're unhappy? Is it the staffing issue? Is it like what is it that's making you unhappy? That is hard for people to identify and to peel the layers back. And I think that's why it took so long for me to leave. I don't think that people should just leave because of the money, because it's not like that. Like I was making such ridiculous amounts of money at my DSO. Like why, if I told you guys the number, it'd be like, well, why did you leave?
Yeah.
Because it's not just about that. Like everything else in your life will begin to deteriorate. It's not just about the money. So you got to really decide, well, why is it that you're wanting to leave? What is it that you're unhappy about? Is it that they're holding you back and you want to really do implants and you can't do implants over here? Well, then there's ways to do it. I would tell them, pump the brakes. What is it that you're unhappy about? And figure out what it is that would make you happy.
Yeah. I love that.
Because leaving a DSO and opening up your own practice might not be for everybody. It might not be for everybody. And the grass isn't necessarily always greener, but it has to fit to your life and your lifestyle. So you really got to decide what it is that you're wanting. There's great associateships, there's great DSOs out there. They're not all bad. And your own practice is amazing too, but it's also really hard. Like nothing is just rainbows and butterflies everywhere. You
Yeah.
really have to identify what it is that's making you unhappy and then figuring out, well, what changes do you need to make.
Amazing. Dr. Coriel, thanks so much for
Yeah.
sharing your story and your expertise. Is there anything you want to leave listeners with or tell them where the best place to find you is?
Yeah, you can find me in the Four Corners area at www.vivadentalstudio.co. Everything's going to be okay. Like if you're a new practice owner, it'll be okay. Just keep your head down, keep working hard. If you're in a DSO, get all of the experience, like all of it. Take time and invest in yourself and do all of the CE that you need. Like get really good at dentistry, because that's what you really need to do is get good dentistry. Get someone who's going to watch you chairside and do that crown prep and say, you're holding that hand speed wrong. Adjust your position. You're going to really hurt your back doing that. Like, invest in you so that you really understand you on why things need to change, because things are good when you're young. When I was 20 and I graduated dental school, things were great, right? You keep your head down, you work as hard as possible, things are fine, you're making good money, things are great. And then they're not, because life is not just this. Life comes up with highs and lows and you have to adjust, and you change as well, and life changes. So listen to yourself, center yourself so you know when to make changes in your life and what those changes need to be.
Mm. Well, there's some powerful statements right there.
Yeah.
Thanks for sharing what it takes to be sustainable in the practice, Dr. Coriel. I really appreciate having you on. Until next time.
Yeah. Thank you so much, Nick.